compensate for the loss of services at Charing Cross and the other hospitals in the region, Imperial Trust has told the public at consultation meetings repeatedly and in documentation that community health services will be in place before hospital services are withdrawn. My question is this, and I want to add a comment at the end. Could members of the panel tell us specifically, not in general, about the future, a rosy future, but specifically, what community services have been planned? Which ones? Where will they be located? Be specific, please. What staffing arrangements have been put in place? Tell us what you've said about it. And how will they be paid for? Figures or budget heads, please. And what is the timescale? The future goes on forever. Be specific. We know when other hospitals are closed. Some of us will be in Mortlake underground by the time these are in place. And further, could you tell us what arrangements have been made to pilot these community services so we can know whether they work or do not work? Without a pilot, what happens? And one specific comment. I think many of us found a comment by a clinician, I'm shocked it's a doctor, to the question from the lady over there about being taken sick on the bus. I've been taken twice to Charing Cross Hospital in an ambulance and got remarkably good service. You should not make comments like that about walking to a pharmacy and taken sick on the bus. There's a picture of a stand-up comedian there. I think what you're saying is quite offensive. You're a doctor. Withdraw.
We have one other question, again, about new provision. So this is Chris Small.
Can you tell me when building will start on the Imperial West site, the new hospital?
Thank you. So I think we go to you, Mark, on both of those, community services and new build.
So,
and you were invited to apologise.
So I do apologise if people misunderstood me, and I wasn't as clear as I need to. If you let me explain, a large number of people who go to hospital for care at the moment could be dealt with it much better, more locally. And there is a national programme that will be starting, looking to encourage people to phone first. And when we've done that in pilots, a large number of people can go to pharmacists, can go to their GP, but it'll also give them advice about which hospital to go to when they need to. So I apologise if I offended people, I didn't mean to do that. But my point is many people could be dealt with better, more locally, and with the pharmacy are an underused resource as part of that. To talk more specifically around the changes and the need to improve community services, at the end of the 5 years of implementation, our expectation is that we will be spending between 180 and 200 million pounds every year in the community services above what we're spending at the moment. There is a range of services, they vary by each borough, so I can't give you the details as you want, but the local CCG can give you those details for Hammersmith and Fulham or Hounslow if you ask them. And that's investment in district nurses, in handymen, in care coordinators, in social workers, in handymen. There are a lot of people who can get admitted to hospital because their house isn't suitable, they don't have ramps. When they get ill, because you don't get the facilities in place, there's a delay in getting it, they end up in hospital. There are a whole range of things, and a lot of work has been done looking at the whole plethora of services that need to be in place. We have been speaking with Health Education North West London, who are the people who are involved in training, doctors, nurses, and all the care professionals that go alongside that. So they're redesigning their plans and training so that we have those staff in place. And a lot of the staff will be coming from hospitals because we need fewer people in hospital and more people in the community. So they're being retrained to provide care in the community. We've been in a system where the amount of spend on community services has been reducing each year, and the spend in hospital has been increasing. That means we don't do the prevention and the care to stop people getting ill, we patch them up when they're ill. And we'd much rather be a preventative system and invest in that, and that's what we're planning. That will take a time. As I say, the plan is that we're talking about a 3 to 5 year plan, and that comes back to the Charing Cross site. At the moment, architects are working, trying to design a hospital and decide.
How dare you!
And decide how they build a new local hospital which will be best to provide modern care. They're building that around the special cancer services there. So there's a special machine called a Linux machine, which gives a particular sort of radiotherapy at Charing Cross. So they're rebuilding a hospital to enable that to continue on site, to build modern care where doctors and nurses and social workers can work together to provide integrated care for the local communication. And so the work on that plan is still happening. Until that plan is completed, I can't give you a building time. But we expect it to be within the next 2 years. They'll be starting work.
No plans. I mean, is that it? James is asking about community services across, isn't he? Yeah. So is that it, or?
What about the pilots?
Yeah.
So pilots are already happening in each of the areas. So the best example of an integrated community service at the moment, and has won national awards, is the STARS system, which comes out of Brent, works with North West London hospitals and provides integrated community services with the social services and the community services in Brent and Harrow. That is reducing hospital admissions. Many more people are being cared for in their home, where they'd much rather be than being rushed into hospital. There are pilots in a whole range of different services, and certainly your local CCG can give you examples of those.
And Chris Moore was asking specifically about that site. Is that a different site, his question? Yeah.
Mark, you've been to meetings like this because I've been with you for the last 18 months. When will you realise that the people of West London do not want your local hospital?
No!
They want a major emergency hospital that's been saving the lives of our families over the last 40 years and beyond. And when we also realise that if you do not communicate with the public, with patients, with residents, that we cannot have any faith in what you do. We went through a complete. What landed on our desks 18 months ago was what was clearly had been 2 years in gestation, a report which was about this closure programme across North West London, and when they realised that there was a hostility to that, they quickly backtracked on the proposals to effectively close completely the Charing Cross and Ealing sites and came up with these local hospital ideas. And that's where they still are. And they have grown over time, partly due to Imperial's intervention, because, as I say, what Hammersmith Council were prepared to put up with was simply a variety of primary care services. Now it looks like we'll have some primary and treatment care services. That's fine, but they bowed out early. Now what it appears we will have is some elective surgery on the side, but it's not good enough. It's not good enough to lose both A&Es in Hammersmith and Fulham, 4 A&Es out of 9 across North West London, and to end up with a service which can barely cope at the moment, having to cope with